Hello, everyone. Today we will explore an interesting topic that is rarely discussed, which is the impact of masturbation on men's prostate health, particularly for those over 60. Did you know that after the age of 60, our bodies undergo significant changes that not everyone fully understands? One of these changes is the effect on the prostate when you masturbate. This not only relates to physical health, but also affects the quality of life and hormonal balance. Let's look at 6 important changes you need to know to better protect your health as you age. 1. Impact on prostate cancer risk. Prostate cancer is one of the most common cancers in men, especially in older individuals. While the exact cause of prostate cancer has not been fully identified, many factors can contribute to an increased risk of developing this disease, such as genetics, diet, lifestyle, and overall health. One interesting factor that has recently been studied is the relationship between ejaculation frequency and prostate cancer risk. According to several studies, regular ejaculation may help reduce the risk of prostate cancer. The reason for this is that ejaculation helps eliminate toxins, inflammatory substances, and excess metabolites in the prostate. These substances, if accumulated over time, can lead to inflammation or cell damage in the prostate, increasing the risk of cancer. Ejaculation helps clean the prostate and prevents the buildup of harmful substances. A noteworthy study conducted by scientists at Harvard University showed that men who ejaculate at least 21 times per month have a lower risk of developing prostate cancer compared to those who ejaculate less often. This study tracked a group of men over several years, and the results showed that a higher frequency of ejaculation could reduce the accumulation of harmful chemicals in the prostate, thus lowering cancer risk. However, this does not mean everyone needs to reach 21 ejaculations per month, but this study suggests that maintaining a regular ejaculation routine could benefit prostate health. In addition to reducing cancer risk, regular ejaculation may also improve sexual health and reduce the risk of issues like prostatitis or benign prostatic hyperplasia, BPH. However, it is also important to note that ejaculation, along with a healthy diet, regular exercise, and regular health checkups, plays an important role in protecting prostate health. In summary, regular ejaculation may help reduce the risk of prostate cancer through the mechanism of eliminating toxins and inflammation buildup in the prostate. While not the only factor, when combined with healthy lifestyle habits, maintaining a reasonable ejaculation frequency can be part of a strategy for prostate health care in men, especially as they age. 2. Temporarily reduce prostate congestion. The prostate is an important part of the male reproductive system, responsible for producing fluids that nourish and protect sperm. However, over time, especially as men enter middle age and older, the prostate may face some issues, such as benign prostatic hyperplasia, BPH, or chronic prostatitis. One common symptom of these issues is congestion in the prostate, causing discomfort like pelvic pain, frequent urination, or the feeling of not being able to empty the bladder completely. One way to temporarily reduce prostate congestion is masturbation. When men masturbate and ejaculate, the prostate cleans out the excess sperm fluids that may have accumulated in the prostate, thus reducing congestion and pressure inside the gland. This works like the body's natural self-cleaning mechanism, helping to eliminate long-accumulated sperm fluids while reducing inflammation in the prostate. Especially for those with BPH or chronic prostatitis, regular ejaculation can bring more comfort, reducing symptoms like pain or frequent urination. In fact, regular ejaculation not only helps clear the prostate, but also has a beneficial effect on reducing congestion and inflammation within the organ. For those with BPH, ejaculation can help reduce the buildup of fluid in the prostate, lowering the risk of congestion and improving circulation within the gland. This also helps alleviate common symptoms like nighttime urination, difficulty urinating, or the sensation of fullness in the pelvic area. However, while regular ejaculation can help improve temporary symptoms, it is not the only treatment for prostate issues. Maintaining a healthy lifestyle, a balanced diet, and regular health checkups are crucial for long-term prostate health. Measures such as reducing stress, avoiding stimulants like coffee or alcohol, and practicing exercises that support prostate health can help reduce the risk of prostate problems. In summary, Masturbation and regular ejaculation can help temporarily reduce congestion in the prostate and alleviate symptoms for those with benign prostatic hyperplasia or chronic prostatitis. While it is not a permanent solution, maintaining this habit may contribute to improving prostate health and relieving discomforting symptoms. 3. Hormonal changes in testosterone regulation. When men masturbate, their bodies undergo a series of physiological changes, including temporary fluctuations in hormones, especially testosterone. Testosterone is a vital hormone that plays a key role in men's physical and sexual health. However, when men masturbate, their testosterone levels temporarily change, which may lead to feelings of fatigue or reduced energy, particularly in older individuals. When a person reaches orgasm, testosterone levels drop immediately. This can create feelings of tiredness, exhaustion, and reduced energy. In younger men, testosterone levels typically recover quickly, usually within a few hours. However, for older men, this process can take longer to return to normal. This temporary drop can affect alertness, motivation levels, and overall vitality. Many middle-aged and older men may feel this fatigue more noticeably than younger individuals, as their testosterone levels naturally decline over time. However, testosterone levels typically return to normal within 24 hours after ejaculation. This means that, although there is a temporary decline, the body quickly recovers and stabilizes testosterone levels. This hormonal fluctuation is not a serious concern as long as it doesn't occur too frequently or cause long-term health issues. In addition to testosterone, another hormone that significantly impacts prostate health is dihydrotestosterone (DHT), a more potent form of testosterone. DHT plays an essential role in the development and function of the prostate. However, when DHT levels are too high, it can contribute to prostate problems, such as benign prostatic hyperplasia, BPH. Research suggests that regular masturbation and ejaculation can help regulate DHT levels, thereby reducing the risk of developing prostate-related diseases. Although the temporary hormonal changes after masturbation may cause some fatigue or energy loss, for most men, this is not a long-term concern. Understanding how testosterone and DHT affect the body can help men adjust their habits and lifestyle appropriately, maintaining optimal prostate health and overall well-being. 4. Increased blood flow to the prostate. When men masturbate, one of the natural physiological responses is an increase in blood flow to the prostate. This is part of the sexual arousal process. When the body prepares for ejaculation, the increased blood flow helps supply oxygen and nutrients to the prostate, supporting semen production. However, this increased blood flow can have some temporary effects on the prostate, especially for individuals with prostate issues. The heightened blood flow during masturbation can cause mild swelling and temporary pressure on the prostate. For most men, this process does not cause any serious issues and only lasts for a short period after ejaculation. However, for those with enlarged prostate, BPH, benign prostatic hyperplasia, or prostatitis, this increased blood flow may cause discomfort or even pain. Enlarged prostate, a common condition in older men, can cause the prostate to swell and put pressure on nearby organs such as the bladder and urethra. When masturbation increases blood flow to the prostate, it can amplify pressure on the enlarged area, leading to sensations of fullness, discomfort, or pain in the lower abdomen. Symptoms such as nocturia, urgency, or difficulty urinating may worsen after ejaculation. Similarly, for individuals with prostatitis, the increased blood flow may worsen the symptoms of condition. Prostatitis can cause pain, swelling, and a burning sensation in the pelvic area, and when more blood reaches the prostate, this inflammation can intensify, leading to prolonged pain or urinary problems. While these effects are typically temporary and do not always cause long-term harm, men who experience prostate-related symptoms, such as pain, difficulty urinating, or prolonged discomfort after masturbation, should consult with a healthcare professional to determine the cause and receive appropriate treatment. Overall, for most men, increased blood flow to the prostate during masturbation is a normal phenomenon and does not result in long-term health issues. However, those with prostate conditions such as enlargement or inflammation should pay attention to the signs and symptoms of their body to take timely care and seek treatment. 5. Impact on urinary function. Masturbation can cause temporary changes in urinary function, especially for men with enlarged prostates or other prostate issues. These changes are primarily related to the effects of masturbation on the prostate, which plays an important role in controlling urine flow. When men ejaculate, the prostate tends to contract to release semen, and during this process, some temporary changes in urine flow can occur. For men with benign prostatic hyperplasia, BPH, masturbation can increase the urgency to urinate or make urination more difficult. BPH is a common condition in older men, where the prostate enlarges and presses against the urethra, obstructing urine flow. During masturbation, the increased blood flow and changes in prostate function can cause a blockage or weakness in urine flow, leading to a feeling of urgency or difficulty urinating. Some men with BPH may notice a weaker urine stream after ejaculation. This is because the enlarged prostate puts pressure on the bladder and urethra, making urination more difficult and less effective. After masturbation, the feeling of urgency or the need to urinate frequently may persist for a short period due to temporary spasms in the prostate. Symptoms like nocturia, nighttime urination, the feeling of incomplete urination, or frequent daytime urination may worsen after ejaculation, causing inconvenience and discomfort. Additionally, when there are changes in prostate size or function, such as in the case of prostatitis, inflammation of the prostate, masturbation can also affect the sensation during urination. Prostatitis can cause pain or a burning sensation when urinating, and masturbation can exacerbate these discomforts or make the symptoms worse. However, these effects are usually temporary and resolve once the body stabilizes. Nevertheless, if the urgency or urinary issues persist or worsen, men may need to consult a doctor to evaluate their prostate condition and find appropriate treatment. In summary, while masturbation can cause temporary changes in urinary function, such as urgency or a weak urine stream, these effects are typically not a serious concern. However, for those with prostate conditions like BPH or prostatitis, symptoms should be monitored and may require medical intervention to improve quality of life. 6. Circulatory benefits. Sexual activity, including masturbation, can offer several benefits for the body's circulation. When men masturbate, the body undergoes a physiological process that increases heart rate and promotes blood flow to organs, including the prostate and genital organs. This is a natural response of the body to sexual stimulation. As a result, there is a temporary enhancement of circulation, improving the delivery of oxygen and nutrients to various organs, especially the heart and brain. Improved blood circulation during masturbation can benefit the cardiovascular system. As blood flows more freely, blood vessels and arteries may expand, reducing pressure within the blood vessels and supporting long-term heart health. Some studies have also shown that light sexual activity, such as masturbation, can help reduce temporary blood pressure and improve blood circulation. This can be particularly helpful for those with weak circulatory systems or blood pressure issues. However, for men with heart conditions, these benefits may come with some risks. During masturbation, the increase in heart rate and blood pressure can lead to symptoms such as dizziness, fatigue, or irregular heartbeats after ejaculation. For individuals with cardiovascular conditions such as hypertension, coronary artery disease, or heart failure, these changes could cause discomfort or even lead to dangerous symptoms like chest pain or arrhythmias, irregular heartbeats. For instance, a 73-year-old man with a history of heart disease may experience mild dizziness or an irregular heartbeat after masturbation. This occurs due to the temporary changes in blood flow and heart rate as the body responds to sexual stimulation. These individuals may need to pay attention to their level of sexual activity and consult a doctor to ensure there are no negative impacts on their cardiovascular health. In summary, while masturbation can provide circulatory and cardiovascular benefits, men with heart problems should be mindful of warning signs such as dizziness or irregular heartbeats after ejaculation. To ensure heart health, these men should maintain a healthy lifestyle, including managing blood pressure, eating a balanced diet, and consulting a doctor if they experience any unusual symptoms. Conclusion: while masturbation can have various positive effects on prostate health, hormonal balance, urinary function, and circulation, it is important to maintain a moderate and reasonable routine. Positive effects such as reduced risk of prostate cancer, alleviating temporary prostate congestion, improved circulation, and supporting urinary function can contribute to overall health. However, it is essential to understand that too much or too little can lead to health issues, especially in older men. Listening to your body is crucial in maintaining health. If you experience unusual changes such as fatigue, reduced energy, discomfort in the lower abdomen, or any symptoms related to prostate, it is necessary to consult a doctor. A healthcare professional can help identify any underlying issues and provide suitable advice to maintain long-term prostate and overall health. Finally, to live a healthy life as you age, it is important to maintain healthy habits, adjust sexual activity according to your body, and have regular health checkups.